Next question is, a 4-year-old man returns to the clinic 1 month after treatment of tuberculosis. He received isoniazid, rifampicin, pyrazinamide and ethambutol. He states he feels fine but now is having difficulty reading and feels he may need to get glasses. What is the drug causing decline in vision? So if you know that we have TB drug which is causing optic neuritis and causing color blindness, green red color blindness, that is ethambutol. So ethambutol side effects are optic neuritis and it is also causing color blindness. Okay na, it is also causing color blindness, and that is too more for green than the red color blindness. Okay, and in ethambutol this is all dose related and reversible. If you will stop giving ethambutol, mostly it will reverse, but these side effects are more common in patients especially who are having renal dysfunction or decreased renal function. Okay na, what are the side effects for isoniazid? If you know, isoniazid will cause peripheral neuropathy, it will cause hallucination, it can cause megaloblastic anemia. Okay, so all these will be the side effect of isoniazid. Pyrazinamide side effects will be, it is a most hepatotoxic, it will increases the uric acid and it can cause severe arthralgia in the patient. Even if you know ethambutol, it will also increase the uric acid level. So these are the two drugs which can cause hyperuricemia. For rifampicin, if you know, red orange discoloration of secretions, like urine will become red orange or tear will become red orange. It can also cause flu like symptoms, purpura, even pulmonary syndrome. Okay na? So in this condition they are asking us about the vision. So vision is mainly affected by ethambutol. And if you know, ethambutol is the only bacteriostatic or tuberculostatic drug in this category. All are bactericidal. So next question is, there is an intern posted in pediatric emergency. Infant was attended by on-call pediatrician who found that the infant has unconjugated serum bilirubin level 33. Which drug mother might have consumed during the 3rd trimester of pregnancy? Okay na? So they are saying that here in this case here is a one drug which has displaces bilirubin from the binding site and which has led to the increased level of bilirubin, okay na, or hyperbilirubinemia. So if you know cotrimoxazole, okay na, so here the answer will be cotrimoxazole. Why cotrimoxazole? Because it is having a compound known as sulfa methoxazole. Okay na, sulfa methoxazole is having very high plasma protein binding. Okay na, because of this very high plasma protein binding, it displaces bilirubin from the albumin, and that's why child is having hyperbilirubinemia. Okay, why not azithromycin? Because it is safe in pregnancy. But if they have given erythromycin, then what clinical picture they have given you? They have given you about hypertrophic pyloric stenosis. Okay na, so erythromycin can lead to the hypertrophic pyloric stenosis. Chloroquine, if chloroquine means it can cross placenta and patient will have increased risk with retinal or auditory nerve damage. And ampicillin is the safest drug we are using in pregnancy related infections. Okay na, so the here correct answer cotrimoxazole, because it is the combination of sulfamethoxazole and trimethoprim. And sulfamethoxazole is having very high protein binding capacity, that's why it is causing hyperbilirubinemia in child. Colonoscopy performed in 25-year-old woman with eating disorder showed dark brown to black pigmented deposit in the lining of large intestine. Histopathology of biopsy reveal pigment-laden macrophages within the lamina propria. On the woman revealed uses of laxative for 9 months to lose weight. What is the probable laxative agent that could have caused this finding? So, first, castor oil. If you know, castor oil is a stimulant laxative. Okay, na? That is mainly work onto the small intestine, and it will increases the fluid secretion and increases the bowel motility. Next is viscodile. It works locally in colon and it increases fluid and electrolyte secretion and stimulate peristalsis. Next is sorbitol. It is a osmotic laxative. Okay, na? Osmotic laxative means it will draw water into the colon and soften the stools and promoting the bowel movements. Now is Senna. Senna is a laxative. It is a GI stimulant. Okay, na? How it will work? It is work by two mechanisms. One, it will direct effect on. It has direct effect on intestinal smooth muscle by stimulating intramural nerve plexus. Okay, na? So it can directly stimulate intraneural nerve plexus, which will lead to the smooth muscle contraction, which increases peristalsis and promotes laxatives effect. Second mechanism is it is metabolized by gut bacteria into renin. Okay, na? And this will increases COX-2 expression in macrophages, and which is increasing the prostaglandin A2 and D2. And by increasing this prostaglandin, it is decreasing the expression of aquaporin 3 in large intestine. And when they will have less aquaporin 3, it will decreases water reabsorption. So this is the second mechanism how Senna is working. Mostly all of the laxative will cause abdominal discomfort, cramps, diarrhea, all those. But for Senna, you need to remember, since it is working into the macrophages, the side effect or specific side effect for this one is melanosis coli. Melanosis coli means dark brown to black pigmentation of colon, and when you will do biopsy, you will find these macrophages, pigment laden macrophages into the lamina propria. So here correct answer will be Senna. Okay, na? So Senna will be the correct answer, which is causing melanosis coli. Other will not cause this effect, but rest all side effects like abdominal discomfort, cramp, diarrhea, all will be the same in other laxatives. Next is a 45-year-old male, known case of rheumatoid arthritis, has been on monotherapy since many years. Symptoms of RA are controlled, but suddenly patient develops blurring of vision. Okay, so this is the classical. Whenever you have any patient of rheumatoid arthritis and having anything related to like eye symptoms or blurring, anything, then the answer will be hydroxychloroquine. Okay, na? Because if you know hydroxychloroquine side effects, it will lead to the bone marrow failure. It can increases QT interval. It can lead to maculopathy, and this maculopathy is also called as bull's eye maculopathy. Okay, na? So bull's eye maculopathy is characterized by irreversible retinopathy with retinal pigment changes. Along with this, it can also lead to the visual field defects like paracentral scotoma. It can also lead to the corneal deposits. Okay, na? So all these will be the side effects of hydrochloroquine, and it is also a hepatotoxic drug. And why not leflunomide? Okay, na? Leflunomide more commonly causes diarrhea, respiratory infection, alopecia, hypertension, and it is also a hepatotoxic drug. It can cause Steven Johnson syndrome. Okay, na? All this, but it is not having any effect onto the eye. It can cause conjunctivitis and periorbital edema, but it has no relation with like this retinopathy or something. Next is sulfasalazine. Sulfasalazine is side effects are anorexia, headache, nausea, vomiting, and it can cause reversible oligospermia, but no eye or no maculopathy. Methotrexate can also cause hyperuricemia, stomatitis, glossitis, all those. It can cause conjunctivitis, periorbital edema, thrombocytopenia, leukopenia, okay na, but it also not affect eyes, okay na, means especially retina. So retina is specifically affected by hydroxychloroquine. So here answer will be hydroxychloroquine. So it is the ideal question. Rheumatoid arthritis, blood blurring of vision, blindness, or any retinopathy, it is classically hydroxychloroquine. Okay, na? So chronic use of hydroxychloroquine can lead to the bullseye maculopathy. Next is a child brought to the hospital with pinpoint pupil, drowsiness, hypotension with slow, shallow breathing after playing at home. What is the most likely substance the child accidentally ingested? Okay, na? So one by one I will come on to the each option. So first one is for atropine. Atropine is a anticholinergic drug, means it will stimulate sympathetic nervous system. So whenever sympathetic nervous system is activating, do we have meiosis? No, we are having mydria. Cis means dilatation of pupil. Other than this, patient will have flushed dry skin, okay na? They will have increase in heart rate, okay na? If heart rate is more, blood pressure will be more. They will have urine retention. They will have increase in temperature, hyperthermia, and they will have altered mental status. So these will be the atropine toxicity symptoms. So this will be for atropine. And what will be the antidote for atropine? Antidote for atropine will be physostigmine, which is the drug of choice for atropine toxicity. Next is organophosphate poisoning. Organophosphate will increase acetylcholine. It is a cholinergic drug, okay na? So it will stimulate parasympathetic nervous system. So okay, in parasympathetic nervous system stimulation we can have meiosis, okay. Plus along with meiosis we will have sludge symptom, okay na? Sludge symptom means S for excessive salivation, L for lacrimation, urination, excessive defecation, GI stress, MSS. Also they will have decrease in heart rate and they will have bronchospasm, okay na? So this will be for organophosphate poisoning. And for organophosphate poisoning you need to remember, mostly they will give you a history of agriculture or farmer who has exposed to the pesticide, and in this condition antidote will be atropine plus pralidoxim, okay na? So which will be the drug of choice. Next is benzodiazepine. If you know, benzodiazepines are, they will cause respiratory depression, they will cause CNS depression, okay. Pupil in this case can be normal or can be slightly dilated, okay na? So they will not lead to the pinpoint pupil, and the treatment of toxicity will be flumazenil, or antidote will be flumazenil. So this is the ideal case of opioid poisoning, okay na? So for opioid poisoning you need to remember few things. First, for opioids there is a classical triad of meiosis. So patient will have pinpoint pupil, respiratory depression, means shallow and slow breathing, and altered mental status. So in this question we have almost drowsiness, pinpoint pupil, hypotension with shallow slow breathing, okay na? Other than this, if you know, they will give you a clue. The child is playing at home and he has ate something, and the medicinal box or that bottle, empty bottle you have found at home, okay, that will be the clue for opioid poisoning. Okay, so it can be because of morphine ingestion, codeine or oxycodone, any can be there. What will be the toxicity symptoms for this? So the mnemonic is morphine. Okay na? So M for patient will have meiosis. O for out of it means CNS depression. Okay. R for respiratory depression, slow and shallow breathing. P for sometimes in rare cases and chronic cases it can lead to the pulmonary edema. So rarely they can have pulmonary edema. They can lead to the hypotension. Okay na? I is for infrequent bowel sound. Okay na? Which says patient will have constipation. So in chronic cases they can have constipation. And N is for the antidote, which is naloxone. Okay na? So naloxone will be antidote for opioid poisoning. And E is a clue that at home you have found empty bottle. Okay na? So this will be the clue. So in this case we have pinpointed pupil means meiosis, drowsiness means altered mental status, hypotension with slow shallow breathing means difficulty in breathing, or respiratory depression. So correct answer will be opioid poisoning. Next is, which of the following antineoplastic drugs should not be given by IV rapid infusion? Okay na? So we will not give that drug which is having side effects, more severe side effects. Okay. So first I am coming on to the cyclophosphamide. If you know side effect of cyclophosphamide, side effect is hemorrhagic cystitis. Okay na? So hemorrhagic cystitis we can easily manage with adequate hydration and mesna. So we can give quick IV infusion within 30 to 60 minutes. Okay. Next is bleomycin. If you know, bleomycin has side effect of pulmonary fibrosis. Okay, and it will also create hypersensitivity reaction. So this we can give short IV push or we can give short infusion. Cytosine arabinoside, this side effect will be myelosuppression and cerebellar toxicity. And this also we can give continuous IV infusion over several days, or even you can give as a rapid IV bolus. Okay, so in all these conditions the side effects are not much immediate, okay na, or not more dangerous. But if you know cisplatin is the most hematogenic drug, okay na, and it causes severe nephrotoxicity. So if you will give rapid IV infusion of cisplatin, it will lead to the intractable emesis or vomiting, plus it will lead to the acute kidney injury. It will damage the tubule of the kidney. That's why cisplatin is never given rapid IV infusion. If you want to give, you will give it for prolonged duration. Okay na? Prolonged duration means 6 to 8 hours of infusion along with pre and post hydration. Extensive pre and post hydration you have to give. Then only it will not cause much nephrotoxicity, or it can be less hematogenic. What will be the other side effects? So other side effects of cisplatin is autotoxicity, especially with the high frequency. It will cause electrolyte imbalance like potassium, magnesium and calcium. So we need to add all these also. And also it can be neurotoxic, which because it can cause peripheral neuropathy. So in this condition we will never give rapid IV infusion of cisplatin, otherwise patient will have severe or very intractable vomiting plus severe nephrotoxicity, which can end up in renal failure. Okay, so this is the answer. Next is a female patient present to the emergency department with severe restlessness, palpitation and tremor. C is a known case of bronchial asthma. On examination, neck looks swollen, BP elevated, tachycardia noted, ECG shows atrial fibrillation. What is the immediate management in this patient? So this suggests us for hyperthyroidism. Okay, na? So I can say patient is right now in thyroid storm. And if you know, for thyroid storm, first line drug is always beta blocker, which is propranolol. Okay, na? But in this condition, female is having bronchial asthma, and propranolol is a non-selective beta blocker. It work on beta 1 and beta 2 both, and because of beta 2 there will be bronchospasm, so we will never use propranolol. So if we are not able to use propranolol, then in this condition we will be using selective one, that is esmolol. So here answer will be esmolol. So why we are using beta blocker as a first line for this? Because they will control cardiovascular symptom, they will control peripheral effects, and they will also inhibit the peripheral conversion of T4 to T3. Okay, na? Also in this condition we can use esmolol, but since it is a cardioselective blocker, still we will monitor bronchospasm. If any problem with this, immediately we will stop. Okay, na? Stop giving the esmolol, and since it is having ultra short acting T half, it will not affect much. So it is not like that esmolol we are giving and we are free, that okay, she will not have bronchospasm. So 100% surety is not there, so we will always monitor while giving esmolol. If any problem with respiration will occur, we will immediately stop. Why not diltiazem? Okay, na? Diltiazem is a calcium channel blocker. It can help me to regulate atrial fibrillation or heart rate, but it is also safe in asthma, but it will not inhibit the peripheral conversion of T4 to T3. If we will not block, again T4 is more and more and more, and it will cause more symptoms. So diltiazem just help me with cardiovascular symptoms. It will not help me with thyroid. Next is propylthiouracil. Propylthiouracil is an antithyroid drug. It inhibits the hormone synthesis. It will also block the peripheral conversion. But the problem is it has delayed onset of action. It will take hours to days to work. Also, it will not provide immediate relief in cardiovascular symptoms. So we can give propylthiouracil, but along with beta blocker will be the comprehensive therapy. So since we want the immediate, and question is asking immediate management, in this condition will be esmolol. If they have not given us bronchial asthma, then the correct answer will be propranolol. So here answer will be esmolol. Next is an SSRI antidepressant such as fluoxetine will be prescribed to an adult patient. You advise him or her to that two of the most likely persistent side effect of adverse responses that may eventually occur at the therapeutic blood level are which of the following. Okay, na? So for SSRIs, you need to remember there are few transient side effects. Transient means immediately after taking drug they will appear. Okay, na? And some will be the persistent long term side effect. Okay, na? These side effects will occur at a particular therapeutic level when we will have more therapeutic level. So these will be anxiety, these will be nausea and diarrhea. As you will continue this drug, they will slowly disappear. Persistent long term side effect will be sexual dysfunction. Sexual dysfunction means they will have loss of libido, even they will have erectile dysfunction. Then male will have erectile dysfunction. Second will be sleep disturbances. Okay, now sleep disturbances means patient can have insomnia. Other than this, they can have. Generally, these are weight neutral, but uh, this fluoxetine can decreases the weight, means it can cause weight loss. But there is drug known as paroxetine, which can lead to the weight gain. Okay, now so these two you need to remember. Generally these are weight neutral, but fluoxetine will decreases only can cause weight loss, but this can cause paroxetine can cause weight gain. Okay na? So here they are asking persistent side effect, then the answer will be sexual disturbances and sleep disturbance. Okay na? Why not sexual or nausea? Because as they continue the drug, nausea will disappear, so this will be the incorrect. Why not tremor or weight gain? Okay na? So tremor are not generally the common side effect for this. So, and weight gain, because he is asking for fluoxetine. Fluoxetine generally don't cause weight gain. Why not nausea and diarrhea? Because these are the transient side effects. They will appear initial phase and slowly they will disappear. So what are the side effects of fluoxetine? You need to remember. Okay na? So we will remember by fluoxetine only. Okay na? So F for feeling anxious means anxiety, and this is because of stimulation of 5-HT2 receptors. Okay na? Next is L, low libido means sexual dysfunction. U is upset stomach or abdominal distress. Okay na? They like nausea, diarrhea, all those. These so nausea is because of 5-HT3 stimulation, and diarrhea is because of 5-HT4 stimulation. Okay na? Next is O means on the edge, so insomnia. Insomnia. Okay na? X is for excessive sweating. Okay na? So they will have excessive sweating. E is for in elderly cases, if you will prescribe these drugs, they will have high risk of hyponatremia, decreased level of sodium. T for fluoxetine, it will lead to the weight loss, so patient will be thin. I is for interaction. Okay na? So drug interaction, like if you will give it cytochrome inhibitor, it will have problem, and if you will give with other drugs like MAO inhibitor, there will be chances of serotonin syndrome. Okay, and for there will be no withdrawal symptoms. Okay na? Why no withdrawal symptoms? Because it is having longer T half. And E is for excitability, means patient will easily get headache and all. Okay na? So these are the side effects of fluoxetine. So in this condition, correct answer will be sleep and sexual dysfunction. Next question is asking which of the following drug is used to prevent niacin induced flushing. So first you need to remember the mechanism of action of niacin. Okay na? So niacin is a directly non-competitive inhibitor of diacylglycerol. Okay na? So it is the non-competitive inhibitor of diacylglycerol acyltransferase 2. So it is a DGAT2 inhibitor. Okay na? So it will inhibit the lipolysis in the adipose tissue. By decreasing the lipolysis, it will decrease the fatty acid level, free fatty acid. If less free fatty acid will reach to the liver, there will be less synthesis of VLDL, very low density lipoprotein, and LDL. Also it will stimulate the synthesis of HDL by inhibiting the, so by inhibiting this, it will decreases VLDL and LDL. But by inhibiting beta chain ATP synthase, it will increases the level of HDL. So it is decreasing the bad cholesterol and it is increasing the good cholesterol. Okay na? Because this beta chain ATP synthesis will inhibit the removal of HDL ApoA1. Okay, and it can also inhibit hormone sensitive lipase, which will decreases the triglycerides. So this is the mechanism. Next is side effect. So side effects of niacinamide are flushing and warmth, which is the most common. So side effect is flushing and warmth, and this side effect is the most common one, and it is mainly because of prostaglandins. Okay na, specifically prostaglandin D2 and E2, which will lead to the vasodilation and they will cause flushing. So I can use a drug which can inhibit the prostaglandin. So which drug can cause out of these prostaglandin? Paracetamol? No. Okay na? Or cetirizine? No. Only dexamethasone or aspirin. But dexamethasone is a broadly broad inhibitor, like it will inhibit phospholipase A2 and then it will inhibit the whole. So no need to use. If we can manage with the low dose aspirin, then the best answer is aspirin. So the flushing is mainly because of prostaglandin, so that's why we can give low dose aspirin, which will treat the flushing. So before giving the niacinamide, just give low dose aspirin and it will take care of your flushing. Then it can also cause side effect, also will be pruritus. Okay na, it can also cause GIT upset. Okay na, like nausea, dyspepsia. So always take it with food. Okay na, it is recommended either take with food or take extended release forms. It is a hepatotoxic drug. Okay na, which is a dose dependent, so always monitor LFT. It can also lead to the hyperglycemia. It will increases blood glucose level, so it can worsen the diabetes, so always monitor blood glucose level. It can increases the uric acid level, can cause hyperuricemia, so it is avoided in patient with gout. Okay na? Next, it can also lead to the myopathy, rarely whenever we are using this with statin, so it can lead to the myopathies. Then it can also sometimes lead to the acanthosis nigricans, because it is causing insulin resistance. So these are the side effects of using niacin. Okay na? So cetirizine is a antihistaminic, it will not help. Dexamethasone, it is a steroid, it can broadly reduce the inflammation, but we cannot not use if we can manage with any COX inhibitor, so don't use this dexamethasone. Paracetamol is an analgesic and antipyretic, which will inhibit the prostaglandin in CNS, so don't use. Mainly the aspirin, which is will go and block the COX and it will help us to reduce the flushing. So in niacinamide, the flushing is because of aspirin, but in vancomycin, the flushing is because of histamine. So at that case, the answer will be antihistaminics, but here answer will be aspirin. Okay na? So thank you so much. We have finished our discussion. Okay, and if any doubt, any query, just mention in group. Okay, or mention in a comment, and I will get back to you. Plus please do like, share and subscribe to our channel if you like the discussion. Thank you very much.